So in terms of treatment moving forward, we're going to keep you on the same dose of thyroid for now.
Right.
We'll recheck in 2-3 months, and if we need to bump you up, we'll bump you up at that time. For your testosterone, we're going to keep you on the same dose, 120 milligrams a week.
Because everything looks pretty darn good.
Looks really darn good.
Right.
But we're going to add...
Some of you have been waiting for this forever. Let's do it again.
Do you want to tell them, or should I? We're going to add HCG.
What?
So, can I tell them why we're going to add HCG?
I'd rather you did.
Really? Okay. So, part of what we're going to add...
Hold on. I'm sorry. I feel like we're getting just slightly ahead of ourselves.
Yeah.
For those that don't know.
Yeah.
What is HCG? Like when you say I'm starting out, what does that even mean?
Yeah. Human chorionic gonadotrophin.
Good Lord.
Whoa. So, in individuals that have secondary hypogonadism like yourself, we made a video on that.
Right, great video on primary, secondary, and tertiary hypogonadism. Link in the description. Super quality with the doctor. Anyway.
Yeah, so with fellas who, not primary hypogonadism, but secondary or tertiary, the issue isn't that your testicles don't work, it's that your testicles aren't getting enough signal to work.
Right.
So what the HCG does is it signals your testicles to make some of their own testosterone.
We're waking up the troops.
Yep.
We're turning my cherry tomatoes into...
Plums.
Plums. I was about to say tomatoes, but I'm like, no, not tomatoes.
Small plums.
Small, but normal sized plums.
Yes.
Okay, and why are we doing this, Dr. Zelfand?
So, part of why we're doing this, one is guys just feel better when there's a little bit of HCG on board.
And this is something you brought up for a long time that I've always just been like, no, I'm cool.
Yeah.
I don't need to do it right now. I'm fine. And something that gave me some of the confidence to do this was the fact that my numbers are in a space to where I'm not worried about it blowing up my levels at the moment. So
yeah, and you were too high for us to
to even consider at the time.
Yeah.
First things first. So yeah, you said you tend to feel a little bit better.
Guys tend to feel a little bit better when there's some HCG on board. The hope is that we will be able to reverse some of that testicular atrophy. That you're a young guy. We don't want you dependent on, you know, this
exogenous
steroid, you know, exogenous steroid for the rest of your life. We want to wake your body up to do some of its own work.
So potentially, could this be like the beginning? I love how I cut you off and you just tap and you just go with it.
Yeah, it's your video. It's all good.
It's our video today. Oh, but I mean, this whole series would be if you weren't doing it. Not that we're having a compliment party with you guys watching. But what I was gonna say is, could this potentially be the start of transitioning off of testosterone, depending on how my body responds?
I don't want to promise that.
But it's potentially.
Yeah.
Because over the years, I've needed less and less to maintain decent numbers.
Yeah.
Because my initial lab work, I'm going to quickly digress, my initial lab work back in the day when I had 200 wasn't crazy. My numbers weren't, I mean, I'm talking initial, it wasn't that crazy compared to like, even when we got a little bit lower, 180, it started to get higher. So I always wonder, is that my body waking up? Is that...
Could be.
Who knows? Anyway, I'm sort of on a tangent, but...
Yeah. Yeah, it could be your body, it could be your receptor sites waking up.
Sure.
Yeah, so, you know, and patients hate hearing this, but this is largely a guess and check process.
Right.
And we don't just shoot from the hip, you know, we make our educated attempts here, and then we check the labs and we check in and see how you're feeling.
So numbers and the patient, like you said, how am I doing, not just what do the numbers look like, so.
Yeah,
that's
but
cool.
I'm going to interrupt you now.
Yes,
because I also want to say the other big compelling reason for adding in HCG is because it stimulates the testes to make their own testosterone. It's also going to stimulate the testes to make more sperm.
Huh.
So adding in HCG can be a fertility supporting or fertility preserving strategy. And since you're such a good looking fella and your wife is such a good looking lady, we gotta keep your options open.
We have to keep my options open. I have the creepiest wing because my mouth opens up and I do it, I'm like...
Yeah, there's something slightly lecherous about it.
Oh, it's lecherous?
Yeah.
What does that mean?
Like, gross.
Yeah.
Yeah.
So, you know, just to reiterate, this is going to improve my fertility. And, by the way, I'm going to be having my fertility checked or tested or whatever this week. And I'll make a video about that because I want to know what's going on right now. I think it'd be really interesting to see how that's going on testosterone, especially as we transition onto HCG. How does that change? I do know, for whatever it's worth, you've had patients before who are on TRT who have gotten their wives pregnant.
Yeah.
So being on testosterone is not a clear-cut guarantee that you won't get your person pregnant. It can happen. I thought it was, and then it happened to a couple people. I'm like, oh shit, there are exceptions to that.
Yes.
Right.
Yeah, it definitely. I'm not just saying that. I've seen it happen.
Yeah, a good friend of mine, it happened, who happens to see Dr. Zelfand. It blew my mind, actually.
Yeah. Cute baby, though.
Super cute baby. Right? Anyway.
So yeah, we'll have you do the sperm study before you start the HCG.
Right, which I'm doing this week.
So we've got our baseline.
Right.
And then we'll start you on the HCG. We're going to repeat your labs in 2 months.
Okay.
Fine tune from there.
And how much HCG are we taking? Do you remember?
Yeah, I'm going to have you do 250 units.
Okay.
Twice a week.
250 units twice a week, and that is a subcutaneous thing.
That is a subcutaneous thing.
Thing. T-H-A-N-G.
Excuse me.
So that'll just be like, I'll be grabbing like the little bit of my belly fat right here, for example, and I can put it right in there. Okay.
That's right.
I'm going to make a video on my first experience doing that, by the way, just because I think that'd be interesting. I will be now sticking a needle in me 3 times a week, but such is life, and I'm lucky to have these therapies available to me. So that is a huge thing. A lot of people are going to miss that. I'll make a separate video, but for those of you that stuck around, after years of talking about it, we're finally starting HCG, and we're running out of time, so... Okay.
We did it.
We did it.
Yeah.
That's it.
Yeah.
That's the big update.
I think so.
Yeah, that's huge. That's awesome. So hey guys, thank you for sticking around, for supporting this channel, for supporting Dr. Zelfand. I'm going to put her information, well, hold on, I'll edit this out. How do you want to be linked?
Sure. ericazelfand.com.
Right.
Yeah.
Okay, I won't put any of that in. So guys, thank you thank you so much for watching this video, for supporting this channel. Be incredibly gracious and complimentary to Dr. Erica Zelfand in the comment section below. She's donating her time, and it's valuable time. She's earned that value, so please be respectful in the comments. You can ask general questions, but it's very unlikely that we can really answer. No, it's completely impossible to answer any personal medical questions, so she is not here in that capacity. This is an educational video. Hopefully you did learn something. Go get blood work. Go find a physician willing to dig deep into what you're going through to give you the best possible care. I'm super lucky for that. So let's just shower her in love in the comments. We'll do a follow-up video if she wants to in a couple months. I think it would make sense since there's this context and things are changing with HCG and with the old getting the boys awoken. And I just appreciate you guys so much. We've done a few of these videos. Look for them. She's been featured on the channel. She's such a great resource, and I really appreciate you doing this. That's awesome. Let's high five that.
Let's do it.
All right, we'll see you guys in the next video. Adios, amigos. To health. L'chaim. Awesome. That video turned out so damn good.
You think?
Oh, yeah.